want to prevent infections. We want excellence. We want to provide good quality care to everybody. Nobody should come to the hospital and go home with any additional infection. My name is Nkwan Jacob Gobte. I'm a nurse by profession. We are here in the Banso Baptist Hospital, Kumbo, Northwest Province, in the Republic of Cameroon. The most important and the most serious problem is that we do not have resources, so we try to use what we have in order to achieve what we want. Lack of resources shouldn't be a barrier. It should rather just be a challenge, and so we need to work to overcome the challenges. The problem we had initially was that most of the babies that were delivered in our obstetric unit, they developed skin infections. And then the second problem was hand hygiene compliance was low due to limited hand washing facilities in most of the units. Then the third problem was there were many items that they were sharing from one patient to another. And so what we were trying to do was to prevent the infections, to promote hand hygiene, and then to introduce individual use items.
Where is the baby's oil? Okay, so this is the baby's oil. Good. We are here in baby change room, and this is a place where we bathe the babies every morning. Before 2002, there was a Vaseline here just by the window. After each bath, the staff will cook the Vaseline and apply on every baby. And then when we started infection prevention, and we discovered that that Vaseline was responsible for distributing skin infections to the babies in the unit.
Immediately we removed the Vaseline. Then the number of cases dropped from 96 per 100 to 38 per 100 within the next 5 months. And over time, they drastically dropped, and we were seeing less than one neonatal sepsis per month. The technology that we created, which is part of the solution, the first one was introducing portable hand washing facilities, which we were able to place in places where we needed sinks but they were not available. The second was introducing hand rub solution, which can be used at point of care. And so what happens is that each time a staff obtains a container, when he uses and it is finished, he will just return it to the pharmacy and collect a fresh container for another use. The sharps bin was also another technology which we introduced. And what we did is that we adapted all injection trolleys with sharp containers. First, to discourage routine recapping of needles, and then second, to promote disposal of needles and sharps at the point of use. And so the purpose was to reduce incidence of needle-stick injuries. The impact of this project, even though at the time we initiated it, our target was the maternity. And immediately when we noticed that it was a good technology that could work everywhere, we quickly disseminated to all the other units in the Banso Baptist Hospital. We have also spread the technology to all other health facilities of the Cameroon Baptist Convention Health Service. So my greatest satisfaction is that we are able to overcome a very difficult problem using very cheap technology and very, very affordable technologies.
It is a program that we admire with all our hearts, and we embrace it, and we want to ensure that this program continues. I want to appreciate Jacob for what he's doing, because he is a leader. You know, we need leaders that don't only say, do as I say, but do as I do. And so Jacob is that kind of a leader that wants to say, do as I do. And so he is a role model to the rest of the nurses. When you see a need and you offer help, that is the way to make the world a good place to live and work.
If other people are going to copy what we are doing here, especially in resource-limited settings, by using their own local material to improve on the infection prevention practices. It is going to be a big booster to the health of sub-Saharan Africa in particular.
Infection prevention is a teamwork, and every individual is involved. I am very proud that we can be able to do so much with very little. And so I think that as much as possible, I will continue to do what I can and to promote the initiative we have developed from Banso Baptist Hospital.